Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to show you a Fraxel laser treatment. This is one of my favorite lasers for skin rejuvenation. It has very minimal to no recovery time for our patients, but is able to accomplish a nice stimulation of collagen. It is a non-ablative laser, which means that it does not actually vaporize tissue, but it creates little columns of heat throughout the skin in a fractionated manner, which means that it's treating a fraction of the skin in tiny dots, almost like little pixels throughout the area. And those little dots of laser injury that are created, the little zones of heat, then exfoliate over the next few days up to a week and cause new skin to generate in those columns. Essentially forcing the skin to become healthier, for the collagen to become thicker, for more elastin fibers to form. So it improves the skin texture, it improves the skin tone, it can help with scarring such as acne scars, fine lines and wrinkles. It helps with sun damage. It's not the best for brown spots or facial vessels, but we do see an overall reduction in redness in the skin, which is really nice for patients who might have rosacea or flushing. And it does help with that, even though it's not a vascular laser. We do see some reduction in pigmentation. But if somebody has more sun damage in that regard, we might combine it with a different laser like BBL. So this also is an excellent laser to combine with other technologies. We often at our office like to combine different technologies to get the best results for our patients. It just depends on what we're actually trying to achieve and what our end goal is. The Fraxel laser may not be the best for really deep pitted scars. We may need an ablative technology or now use the fractional RF technologies for that. But really an excellent overall laser. I highly recommend it just for about anyone who's starting to notice some laxity in their skin, who's starting to notice some changes of aging that are starting to happen. So it's not, like I said, not a lot of recovery time, just a little bit of redness after the procedure. Patients are allowed to wear makeup and their normal moisturizer immediately after the procedure. I do recommend avoiding Retin-A or retinols on the skin afterwards. We've just put a little bit of numbing cream, which has been, which I'm wiping off here on his skin right now, and then we can get started with the actual procedure. I do like to use a little bit of cold air just to make it a bit more comfortable for the patient during the procedure as well. So this laser handpiece here glides along the skin, and it will only fire when it is contact with skin and the foot pedal is depressed. And it will create a little pattern of laser dots, which you may not be able to see. So here we've treated half of his face at this point. If you look super close, you can see tiny little dots on the skin where the laser dots have been created. And like I said, these will exfoliate then over the next week or so as that new skin is going to regenerate. This procedure is different from an ablative laser like fractional, where we're actually vaporizing dots on the skin, and then that takes a little bit longer to heal, and you do have to wear a protective ointment in that type of situation. But with the Fraxel laser, a normal moisturizer is okay afterwards. We do ask you to avoid any retinol or Retin-A products. And like I said, it does help also with facial redness too. If I put all the little dots together that we've created, we've probably covered about 20% of the skin surface. So I do recommend repeating this procedure 4 times to get the very best results, because at that point we've probably covered about 80% of the skin surface. Okay. All right. How was it?
Very good.
Very good. How did it feel? Was it like little prickly
A little
dots?
prickly, a little bit of warmth, but not not too not too uncomfortable, and
Good.
I think the cool air helped. So
The cool air helped, yeah,
good.
It'll feel like a sunburn for about 20-30 minutes, and then you should be not in any real discomfort. You might have a little bit of swelling, okay, and the redness is usually gone within a few hours, but it may persist for a day. You should definitely wear sunscreen, you know, if you're going to be outdoors at all. Protect your skin from the sun, and just a good hydrating moisturizer. Okay?
Very good.
Your skin will start to feel gritty within the next few days. When you touch it, it'll feel like sandpaper, because all those little islands of heat that we've created, those little cones, will start exfoliating. Okay?
Sounds good.
So, but that is part of the way this procedure works and how it's going to help you heal and look awesome.
Awesome. Well, thank you.
All right. Thank you.